Hi, everybody. Welcome to Raw Talk. This is Dr. Diane Mueller, and she is the creator of Medicine with Heart. Thank you for being here today, Dr. Diane. How are you?
I'm great. How are you, Kelly? Thanks for having me on your show today.
I'm really good. Thank you. So Dr. Diane and I met through Molly Bloom, actually, through a little support group that she created back in the pandemic when we all got shut down and had to stay home. So, and I'm so grateful our paths have crossed. So yeah, as soon as I learned a little bit about you and what you do with me having an autoimmune, I was very, very curious to learn more. And so why don't you just go ahead and, first, what I read about you was you yourself had mold, issues from being exposed to mold, fibromyalgia, leaky gut, and Lyme disease. And that obviously must have promoted you to learn more about the medicine, right? So tell me a little bit about your journey.
Yeah, absolutely. So I actually had IBS symptoms start when I was a young child. I would sometimes go a couple weeks without having a bowel movement. So some pretty severe chronic constipation. And the way I describe that period of life to people is like when I entered my teen years, when we're, pretty self-conscious naturally as we're coming into our own and that sort of thing. I would swing between 6 to 7 pant sizes. So I could be like a 4 or a 6 one day, and I could be a 12 the next day because of how bloated and constipated and distended my belly was. But I did all the standard tests that conventional medicine does, and that was good because they ruled out, the bad things. I didn't have cancer. I didn't have an autoimmune disease. I didn't have these things that they were able to rule out. So I kind of got stuck in this category that it was just IBS, where there wasn't a lot that was in conventional medicine toolbox other than just taking a laxative. So that's what led me into medical school. And then when I was going through medical school, I started getting all these really, really strange symptoms. I was losing sensation in my fingers and toes. I was having these what are called depersonalization events, where it was almost these out of body experiences where it was I'd be up here, I'd be high in my brain, looking down on my body, really disconnected. So having memory loss, forgetting where I lived, these types of really scary things. And it was kind of just brushed off at that point by me and by the doctors I was seeing as just medical school syndrome. You're tired, you're fatigued, you're up all night studying, and then when I graduated and all my colleagues were getting better and healing from medical school syndrome, and I was actually getting worse, that's when I really knew that something was going on. And that's when I, found Lyme disease and mold illness and had previously had fibromyalgia mixed up in there as well. So how I largely healed myself is very similar to how we work with all of our clients at the Medicine with Heart Clinic, which is really by doing a lot of tests that honestly are just different than what's done in conventional medicine. Conventional medicine is so good at looking for these big, big things, but they don't actually commonly offer every test that's out there just because their lens is different. It's a very, very good lens, but their lens isn't complete. And so functional medicine works, hand in hand with conventional medicine by kind of filling in some of those gaps with lab testing and root causes, looking at medicine in a slightly different way to help find some of these gaps that just is not in their consciousness. So once I found Lyme and mold, as well as SIBO and parasites, I had almost a half dozen different infections in my gut. And once we found all those, then we could fix and heal them.
Oh my God, that's crazy. So that's really crazy because my autoimmune, so, I've talked a lot about my autoimmune with my audience, and we were recently talking about some other symptoms that have been coming up for me that you said might be as symptoms of Lyme disease. So, and I've never been tested for that. So now I'm even more curious about, because I'm still having issues. The issues, they keep showing up. So not only am I having issues of the autoimmune hepatitis, which I already have, but I'm having new issues coming up. So there's something that I'm missing that Western medicine is not finding. So yeah, which is why I'm so grateful that I found you. So and we're finally working together.
Yeah, absolutely. And the thing with autoimmune disease is like, it's great to have a diagnosis, right? And sometimes we can have so much relief when we're so sick to have somebody just put a label on it and say, ah, this is what's happening. But the thing with an autoimmune diagnosis, whether it's AIH or whether it's Hashimoto's or lupus, the thing that gets so confused and start attacking it. So really good at is really going through and saying, okay, why did your immune system get out of balance?
1 second.
Why? Yeah.
Or when you were talking about Hashimoto's and a few words before that, you were cutting out when we missed that part. Can you go back just a little bit?
Yeah. So when we have Hashis or AIH or lupus, any of that, it's really great because we do have the information and that the immune system's out of balance, right? Your immune system's out of balance. It's attacking your own tissues. So it's a great place from an education standpoint and a medical standpoint to be, but it's not telling us why. It's not telling us why the immune system got so out of balance that it started basically attacking your tissues. And so there's a lot of different reasons why the immune system will go out of balance. Sometimes it can be a chronic hidden infection like Lyme. Sometimes it can even be a nutrient imbalance can throw the immune system off. Leaky gut can do it. Various other infections like viruses and fungus. Heavy metals can do it. Genetic predisposition to not being able to detoxify well. Any of these things can trigger the immune system to basically get confused. So in like working with AIH or like any other autoimmune disease, the key thing, like number one step is to say, for the uniqueness of you, Kelly, or for any other your listeners with autoimmune disease, for these types of conditions, what was it that actually was your unique thing that made your immune system kind of go haywire? Does that make sense?
Yeah, it does. So yeah, so something triggers the immune system to go haywire, right?
Yes.
And that's where they can't find the why. And that's where you have to dig a little bit deeper, but they only, you kind of hit a wall a little bit with Western medicine where you just don't get any other answers, I guess, right?
Yeah. And some of the problem with that is purely, just that insurance companies are a little bit regulating what doctors are allowed to look for. And that's, we have a problem, unfortunately, with medicine where there is like an overarching model, problem where doctors are not always allowed to run the tests because of insurance companies that they want to. So that's a challenging thing we see. But the good thing is there's ways around that. And the thing that I really like to emphasize for people is it's all, every person in conventional medicine that I know deeply cares about their patients. So it's not a lack of like care. It's just a lack of sometimes hands are tied and things cannot be ordered just because the process and the model is different.
Right. That makes sense. And yeah, I mean, let's call a spade a spade. I mean, it's a business, you know what I mean? So I mean, it was created to be a business. So my question is, when you were in medical school, what did you initially want to do when you started medical school?
I initially, just got into it just because I wanted the information and I loved science and I wanted to help people. And that's honestly like all I knew at that time. So I didn't know which way I was going to go as far as a niche or a specialty or anything like that. It was purely just that I just wanted the knowledge. I knew I was sick. I felt like there was answers that weren't being told to me, and I wanted to figure them out for myself and then help other people. And I really got into the advanced chronic illness and chronic disease world when I just had my own journey. And, it's nice to help people when we've walked a journey ourselves, because it really helps with, empathy and understanding.
Right. So when, as you came through this and you had your own issues, you were able to actually healed the mold issue, you healed the fibromyalgia, the leaky gut, and the Lyme disease, right? You brought everything back into balance by just digging into, it's like it's like drilling into more blood tests, more finding that root. And that's really what your practice is about, right? Getting to the root.
Exactly. When we find it, we can fix it. We just have to find it.
Right. So take me through kind of like now we know that you're in Lakewood, Colorado, and that was my concern because I'm in Arizona, and how would I work with you, state away, 2 states away, whatever. What does that look like working with you, time wise? And obviously we know that insurance doesn't always pay for homeopathic medicine and things on that nature. So how does that work working with you?
Yeah, so we do treat people all over the country. We sometimes do Zoom, we sometimes do phone, whatever is easiest works for us. So distance is not a problem. And like I was mentioning to you, but to share this with our listeners here, that we actually are partnered with labs all over the country, so it's pretty easy with that. Was like 3 or 4 hours that there's ever been. Speaking of internet, my internet just did something weird. Are we still together?
It did. Gosh dang it. Okay, it did.
Shoot.
You okay?
Yeah, I'm good.
Okay. All right. Cool.
Okay.
Okay. So go back about 30 seconds because we did lose you there.
Okay. So when people are far away from a lab, sometimes like as long as you're basically close to a major city or able to drive to a major city, we can get a blood drawn. And the other thing that's so amazing is depending upon what we're looking for in your body, sometimes blood's not the specimen that's best. Sometimes it's urine, sometimes it's breath, sometimes it's stool, right? So if it's anything other than blood, we actually can just send you a collection kit, and you can just basically collect in your own home and just mail it to the lab. And we just give you like the FedEx label or the UPS label. You just slap it on the sample, drop it off at UPS. It's so easy. Mm-hmm. So we walk all our clients through that.
Perfect. And then like you did so you were going to share your screen with me because you have some sort of little promotion or something going on, right?
Yeah. Okay. Yeah. So let me. Okay, right now it says that I guess you have to help me with screen sharing.
No. Oh, I don't know if I can. Oh, wait, screen sharing right here. Hold
on. Okay, so there we go.
Did it work?
Nope, it says it's still disabled. If not, I can put this information in the chat here too. Oh, there it goes.
Did that work for you?
Okay. No, it did not. So what if I put this information in the chat? That would be. So does that work?
Yes.
So basically what this is one of the there's a lot of main causes of autoimmune really, but a huge one that I see involved about 70% of the time as one of the roots. Oftentimes there's a lot of roots. Like I said, I had about a half dozen infections in my gut as part of my illness. So there's usually like kind of a conglomeration, but one of them that we see really, really commonly is called small intestinal bacterial overgrowth. And so this is something that we have treated hundreds and hundreds and hundreds of cases. It's fairly easy to walk people through how to do this and how to guide themselves. So this basically is a course that we created as a way of reaching people that couldn't always afford services and still being able to help them. So it's a self-guided course. And for your audience, if they go to the screen, go hit enroll now, they can and type in the code IBS free, all lowercase, all one word. It actually will allow them to enroll in this self-guided course for free. So
okay, so if they go to your website, if they just copy and paste that, they'll be able to get it, right?
Yeah, and then just make sure that they put in that code to bring it down to free for them.
Okay, all right, perfect.
Yeah.
So that's so interesting that there's so many different things. I mean, yeah, I mean, I'm learning that, yeah, I got bit by a tick, and so maybe I have some Lyme disease, and I had IBS. I've had that since I was 13, and I have the same struggles you did. So that's another, factor of why I'm going through what I'm going through, amongst, who knows what else I was exposed to. And all they told me when they diagnosed me was it was from an allergy in the environment. Leads
Yeah.
me to a million things, that could be anywhere from Windex to a Lysol wipe. I mean, my God, I'll never know.
Got it. You
Right?
got it. Yeah, absolutely.
Yeah.
Absolutely. And one of the things too, just to share with you, I know you mentioned that, knowing there's answers brings hope. And one of the things that I find that people are often told with autoimmune and with chronic disease in general, I was told this, is that they have to live with it. And the good thing is that this is most of the time not true. And we see, like with autoimmune disease, I see symptoms 100% resolve, and I see autoimmune markers go completely normal. So maybe there's still something going on, like so deep down, but if symptoms are gone and the lab tests say it's gone, then for all intents and purposes, in my mind, it's pretty much gone.
Right.
So, I do to really, try to help people have a lot of hope, because so many people are just told that they have to live with this. And it really, most of the time, is not true.
Well, and that's exactly what they told me. They said, I said, can I ever go into a remission? And the doctor said, 9 times out of 10, no. And I shared with you before we went live that I recently tried to go down on my meds. And within 2 weeks, I can feel my enzymes. I'm not feeling very good today because I can feel my enzymes are a little high, which was very discouraging before we talked about this, because clearly I still have the autoimmune issue, because the root thing, whether that be this stomach issue or Lyme or something else going on, is not been brought to the surface. Like, I don't know what that is. So I am finally hopeful. And I know that people, oh my gosh, I've been on an autoimmune Facebook page with so many people going through a lot worse things than me, and on a lot more stronger medicines and prednisones and things of that nature that are harmful long-term anyway. They will be really, excited to connect with you. Were you able to get off most of the meds, like the Western medicine meds?
Yeah. My best case of getting somebody off meds was somebody, she was on 14 meds and she's on 0 now. So we've seen some like really amazing. And then there's people that are on like, 3, 4, 5 that we get off. And, occasionally there is somebody that does need to be on a medication or two. There's value in having that as a tool. So we're not opposed by any means, but because of the side effects, we've really worked to minimize that as much as possible. And in most cases, we can get people completely off. But like I said, there are exceptions where we do find that it is useful to have some level of medication.
Right. But the fact that you guys go a little bit, a ton deeper than Western medicine is going to give a ton of people hope. And I'm really, really excited to start working with you and then share with, my audience just the transition of how I feel and what's happening in my body and how I'm healing. So thank you so much. I know you're a little short on time. I really appreciate you being here, and I will definitely post this to you guys. I'll give you all of Dr. Diane's information of where you can find her, how you can find her, and your presence and your being here is so valuable, and I really, really appreciate the time.
Oh, it's my pleasure. I'm happy to be here. Thank you for hosting. And it's really part of my mission to just bring hope and help as many people as possible. So thanks for, helping pass that along. It's so meaningful.
Absolutely. Well, thank you so much, and have a wonderful day, and we'll talk soon.
That sounds great, Kelly. Take care.
Yeah, you too.